Which of the following can be used in initial management of heparin-induced thrombocytopenia? Fondaparinux, rivaroxaban, lepirudin. Red cells protoporphyrin levels will be raised in absolute iron deficiency, relative iron deficiency, lead poisoning. Negative iron balance is the first stage in the progression to iron deficiency anemia. Which of the following laboratory investigations will be found deranged in this stage, thereby pointing to early iron store depletion? Bone marrow iron stores, serum ferritin, total iron binding capacity. Which of the following drugs carry a definite risk of causing clinical hemolysis in a person suffering from glucose 6-phosphate dehydrogenase deficiency? Primaquina, dazone, or tremoxazole, nitrofurantoin. 40-year-old male present with complaints of generalized weakness, weight loss, abdominal discomfort, and decreased appetite. On examination, splenomegaly massive was present. On investigation, it was found that hemoglobin was 7 gram per deciliter, platelet count 8 lakh per cubic millimeter, WBC 9000 per cubic millimeter, chronic myeloid leukemia. Which of the following are risk factors of type 2 diabetes mellitus? Family history of diabetes, physical inactivity, polycystic ovary syndrome, PCOS. Which of the following statements with regard to gestational diabetes mellitus (GDM) are correct? Most women revert to normal glucose tolerance postpartum. Glucose intolerance develops during second and third trimesters. Insulin resistance is related to metabolic changes of pregnancy. A thyroid function test report shows following result: TSH undetectable, T3 raised, T4 raised. Primary thyrotoxicosis. Biochemical abnormality seen in severe hypertriglyceridemia, pseudohyponatremia. Statements correct about vitamin D supplement. Serum calcium levels improve earlier than serum PTH levels. Vitamin D supplementation should always be in conjunction with calcium supplementation. Nephrolithiasis is a known complication. The first line investigation for diagnostic evaluation of patients with hypercalcemia. Serum IPTH levels. Cause of lymphadenopathy in HIV positive patient: Kaposi sarcoma, lymphoma, tuberculosis, persistent generalized lymphadenopathy. A patient receiving chemotherapy develops neutropenia. He presents with fever, cough, expectoration, chest pain, and hemoptysis. His CT scan of chest reveals nodular infiltrates with halo sign and crescent sign. Most useful drug for treating him: voriconazole. A patient undergoes splenectomy after an accident. He will require oral prophylaxis against Streptococcus pneumoniae. A 30-year-old male recently diagnosed with HIV presented with odynophagia. He was started on proton pump inhibitor and an upper GI endoscopy was done. There were serpiginous ulcers in a normal surrounding mucosa in distal esophagus. Most likely diagnosis is cytomegalovirus esophagitis. Which one of the following statements regarding post-gonococcal urethritis (PGU) is correct? PGU refers to non-gonococcal urethritis in men treated earlier with single dose of penicillin. Gold standard treatment for brucellosis in adults: streptomycin and doxycycline. Which one of the following has the highest risk of human immunodeficiency virus HIV transmission after single exposure to an HIV infected source? Blood transfusion. Statements with regard to vitamin C are correct. Perifollicular hyperkeratosis is a clinical sign of scurvy. Infants fed exclusively on boiled milk are vitamin C deficient. Statements correct in respect to vitamin D. Skin exposure to sunlight is the main source. Vitamin D synthesis decreases in winter as one moves away from equator. Body store accumulated during summer is consumed during winter. Treatment of acne vulgaris: topical benzoyl peroxide, topical antibiotics like clindamycin, oral isotretinoin. One of the cause of scarring alopecia: radiotherapy. Mood stabilizers for the treatment of bipolar disorder: valproic acid, lamotrigine, carbamazepine. An early alcoholic man who mainly eats a diet of maize and maize products presents with complaints of chronic diarrhea, severe sunburn-like lesions, tension on exposed parts, and acute delirium. He is admitted. Diagnosis and treatment: Pellagra niacin therapy. Which one of the following is an indication for self-injectable adrenaline? Epinephrine. anaphylaxis to allergens that are difficult to avoid. Statements with regard to arteriovenous fistula in dialysis patients are correct. Distension and thickening of vessel wall occurs. Arteriovenous fistula formed up to a year before dialysis is contemplated. Synthetic graft may be used if fistula formation is not possible. An infant was born at 30 weeks of gestation and weighs 1.2 kg at birth. Which of the following is recommended initial feeding method? Orogastric feeding. A newborn delivered at 32 weeks gestation is started on spoon feeds after birth. On feeding with spoon, the baby demonstrates some spilling and coughing. What is the next step in management? Orogastric or nasogastric tube feeding. Child speaks bisyllables like mama, baba. He is able to sit without support and looks at the source of sound diagonally. His likely age is 10 months. After sustaining a head injury, a 18-month-old child displays eye opening only to pain, moans on painful stimuli and withdraws to painful stimuli. Modified Glasgow scale score is 8.